Hi guys, so today's video I'm just going to show you how I debond a case from start to finish. Hope you enjoy it. Okay, so the first thing you want to do is obviously take off all the all your donuts and power chain and things like that. This video is actually specific to the Gemini 3M Gemini brackets. If I was using a different kind of bracket, I'd probably debond it with the wire in place. But here we've got the 3M, and you've got to take all the brackets off individually. Then with the donuts off, we just take off the wire. And now we're using a special 3M debonding plier. So this plier is specially designed to break the bracket in half and the whole thing comes off gently. So you can see here I'm just grabbing each bracket individually, gently squeezing it, and what happens is it just clicks and then you just rock it forward and back and the whole bracket just comes off. You've got the high volume suction there to collect any kind of debris. Okay, so you can't see it that well here, but that bracket on the upper left 4 has half of it's come off the tooth, but half of it is still bonded on there. So what you got to do in these cases is just get a wine guard plier and just gently tease it off, or you can take a high-speed burr to it and then just break it off. Just a quick note: you see this lady's got this this peg lateral, and I'm actually going to build it up in Composite, but I'll show you that next week. So here we are, all zoomed in on this tooth. Sorry it's not quite in focus, but I think you'll get the idea. What you need to do is use your tungsten carbide burr, this will just remove the composite and leave your tooth intact. And you want to use gentle, almost like paintbrush motions, just to get the composite off the tooth without damaging the underlying tooth. And you can see the natural tooth here is kind of like shiny a little bit, whereas the composite, because I've run my burr over it once, is actually quite a matte finish, so you can clearly see where the composite is and where the tooth is. And here's just a zoomed in version on the other tooth. It's pretty much exactly the same thing going on here. In between here I built up the lateral, so now the lateral's all built up and we're just cleaning the lingual surfaces of the teeth where the retainer is going to go on. This is just dry pumice with a bristle brush. Next we just etch the teeth. So this is just normal, how you'd stick on a composite, so just normal restorative etch. While it's etching, I like to just measure out how much I need. So this is the retainer chain that I use, just a bit of bond. Cure the bond, and then you just want little dots of composite going on where you've pre-planned your retainer to be. Not all the way around the tooth, but just little dots just to hold the retainer wire. So then you take your retainer wire, which you've pre-measured, and you just place it into these dots, and the composite should just hold it. I do this bit with direct vision, so sorry I can't show you exactly what's going on here. Just confirm the position with the mirror and make sure you're good to set it, and then just cure that in position. Then go over each tooth individually and get enough composite flow over each bracket, so you get good mesial to distal coverage. That's really important. Okay, so let me just quickly show you a couple of things to bear in mind when getting this retainer on. So it's an upper retainer, and most of my upper retainers only go from 2 to 2. Okay, I find I get loads of debonds if I include the 3s, so I tend not to do it unless the occlusion is completely clear there. Now, can you see the composite runs from here to here, right? It's as mesial and as distal as I can possibly get it. This is because the wire here is actually flexible, so we want to keep the actual distance in between the teeth, this and this here, to an absolute minimum. And what this is going to do is going to stop relapse. Okay, so that's one thing to bear in mind. And secondly, in this particular case, she had quite a deep bite at the end of treatment. So it's in deep bite cases, it's difficult to get the retainer on. But what I did, I kept it as gingival as I could. But secondly, she is occluding here and here. right? So warn the patient if you've got deep bite and you're going to do this, that all the biting is going to be on the centrals, and it's going to be really annoying initially, but everything will settle. I've seen her sort of a month after we did this, and she said exactly the same thing. It was annoying to begin with, but it's settled and the bite is much more even now. The reason for this is the buccal segments are all settling. So you can do this. Make sure your bond is really great. If you've got occlusion only on one tooth, then you're probably going to get debond there. Try and get it as even as possible, ideally more than 2, but I'd say 2 is an absolute minimum. Cool. So I hope you got something out of this video. Next week, what I'll do, I'm going to show you the same case, but if you notice, I actually missed a whole chunk out where I built up the lateral. So next week, I'm going to just fill in the blanks and show you how I built up the lateral. And because this is really common, this lady had a peg lateral, we did the braces, and how I planned the position of the tooth and how we built it up just in composite. So until next time, I'll see you later.